is suitable for general family viewing.
My name is Peter Njeraine Gatume, 50-year-old, father of 3 girls. I'm one of the latest successful kidney transplant patients at MP Shah Hospital, and this is my story. It's a brand new lease of life. I'm able to carry out my duties more effectively. I have a lot of time in my hands since I'm not going to the hospital every other day to spend 4 or 5 hours on the dialyzer. So I'm really grateful for the success of this operation. I received the new kidney on 3rd of May 2022. I was in dialysis for 2 weeks to a full year. I started on 31st of May 2021. 3 weeks prior is when I had been admitted with a COVID attack. Brought about pneumonia, brought about very high blood pressures that promptly ruined my kidneys and eyes at that time. I've been type 1 diabetic since I was in Form 2, that's 1987. So it's been a journey, 34-year-old journey. I've worked with courage, a lot of information. My dad once told me that for you to survive a chronic disease, the only thing you can arm yourself with is a lot of information.
Welcome again to Body Garage, the art of well-being. And today we are going to talk about everything as far as the kidney is concerned. I have my guest here, Dr. Hussein, that is going to take some minutes to educate us everything that you may need to know about your kidneys. Welcome, Dr. Hussein.
Thank you very much.
It's a pleasure to have you.
Same here.
Great. Before we go into the details of today, let's just take some seconds and get to know who you are.
Okay, so as you said, I'm Dr. Hussein Baga. I'm a consultant physician and nephrologist or a kidney specialist working here at the MP Shah Hospital.
Yeah.
I run the transplant unit and the renal unit here at the MP Shah Hospital.
Yes, all right. So just a few details about the kind of services that you do. As you mentioned, one of them is transplant services.
So here at the MP Shah Hospital, we have a robust kidney transplant program, which we started in 2018. And I can humbly say that it has been a very successful program. We've done more than 25 kidney transplants, all of them being very successful. We also run a hemodialysis program here at the MP Shah Hospital, which is fully reimbursed by the NHIF. So the patients don't have to pay anything as long as they're covered by the National Hospital Insurance Fund, which caters for 2 dialysis sessions per week,
Okay.
which also includes being seen by the specialist for free once a month. They also get the medications during dialysis, which is your erythropoietin and the intravenous iron, which are the blood builders, for free as well every dialysis session. And we also do monthly blood tests for free within the program as well.
Okay.
We also run the renal clinics here on a daily basis, where patients with all stages of chronic kidney disease, acute kidney injury are seen. Of course, we also see the inpatients as well, those who are admitted with kidney problems in the wards as well.
That's quite something good for the people. All right, let's go now to, when you talk about dialysis and all the services, it's making in reference to the kidney. What is the kidney and what is its function in the body?
So we normally have 2 kidneys in the body, and they're very important organs, and their functions among them include basically regulating the water in the body, because remember that every time we're taking in water, we're taking in food which contains water. Our body only requires a specific amount of that water. The rest of it has to be removed from the body, so the kidneys are very integral in terms of regulating that. Our bodies produce a lot of wastes or poisons when food is digested. There are a lot of chemical reactions that are happening in the body. All of that is removed by the kidney.
Yes.
We also have electrolytes as well, specifically potassium, which is very important, calcium, phosphate. All of that is regulated by the kidney as well.
Yeah.
The kidney is also very important when it comes to the level of blood regulation, because it produces a specific hormone called erythropoietin, and that is important in improving our hemoglobin. It's also important when it comes to the acid buildup in our body, not the acid that is in the stomach, but the acid in the blood.
In the blood,
and it helps to regulate it as well. So it is one of the most important organs in the body.
Yeah.
Yes.
Where is it found in the body? Somebody might say that somewhere.
No, I get that a lot from my patients, because they'll always come and point to the stomach and say that I have kidney pain.
Yeah.
Now, unfortunately, that is not true. So the kidneys are basically found at the back. Yeah, somewhere around here, just below the rib cage.
Just below the
rib cage.
Back.
Yes, at the back.
Both sides.
On both sides. So we have 2 kidneys, one on each side normally, and that's where they're found. And normally you don't feel kidney pain unless, of course, if you have either an infection, or you have developed a kidney stone, or you have developed a cyst in the kidney. A cyst is like a balloon-like cystic structure that is found, that develops in the kidney, which sometimes can get infected or can bleed into it. So there's a time that you get pain. A lot of people mistake different conditions for kidney pain, because they feel pain in the anterior or the part that is here on the front side, and they always attribute it to kidney pain. And thankfully, majority of it is not the case, but it's always good to be on the safe side and have your kidneys be checked out if you suspect that you have any kidney problems.
So, can we have one kidney and live?
Yes. Some people are born with one kidney. It happens. And unless if it is discovered, most of the time it's incidentally discovered when you do a scan for whatever other reason, they can lead healthy lives. When it comes to a kidney transplant, so remember, a kidney transplant, we basically get a kidney from a healthy person and then transplant it into somebody who has got kidney failure. And the only reason we can do that is because we know that that person can live safely with one kidney throughout the remainder of his life or her life. So it is, somebody can live with one kidney safely and lead a normal life. Yes.
All right. So let's talk about some of the things that might cause problems to our kidneys. We live every day. There are maybe things that we do that we don't know eventually are going to cause problems to our kidneys.
So the most common things that we do on a day-to-day basis is taking over-the-counter medications. Like you get a headache, you have a fever, you go to the pharmacy or you go to one of the shops and you get the non-steroidal anti-inflammatory drugs. Like Brufen, diclofenac, even drugs like Headaches and Maramoja that are sold in supermarkets. These contain the non-steroidal anti-inflammatory drugs, and these drugs are quite dangerous for the kidney. And especially more so when you are dehydrated, like for example, you've been vomiting, having diarrhea, you're not feeding well, and then you take these medications. or you already have pre-existing kidney disease and you take these medications, you are basically causing more harm to the kidneys. The other thing that we are tending to do is taking herbal medicines. Now, unfortunately, these herbal medicines have not been tested. We don't know what ingredients are in them. And some of them basically cause kidney damage, which unfortunately sometimes is not reversible. And you see, people will be taking them because they're like, oh, the pharmaceutical industries are just out to make money from us. So they'll go to a traditional healer and get some concoction of herbs, which they'll be taking on a regular basis. And they're like, yeah, this is making me feel healthy. But unfortunately, this can be causing more damage to your kidneys.
Do you find many cases that have come with kidney disease because of herbal
I have found a few. Thankfully, with the awareness that is going on, people have reduced the intake of the herbal medications. Main problem now is the over-the-counter medications, especially the non-steroidal medications. These ones we see quite a lot, unfortunately. So that is a major challenge that we are facing as doctors.
All right. So you've mentioned to us too the medications, the herbals. So
those are the things that people do generally. And the other thing is, of course, our health-seeking behaviors, which is very, very important aspect that we tend to face as doctors, because we tend to see patients who come in when their kidneys have already failed. They come in what I call extremis. They come crashing to the hospital because they have a lot of water in the body, what you call fluid overload. It is basically they're not able to breathe, and they also have the toxins that are built up in the body, which is making them vomit, and sometimes they also come in confused as well. And they have a lot of acid build-up in the body. So they come in the extremis where there's nothing that can be done apart from dialysis. So there are people who are at high risk of developing kidney disease. Especially those who have pre-existing conditions like diabetes and high blood pressure, or family history of kidney disease. And unfortunately, one is that either we don't diagnose the diabetes or the high blood pressure because people don't come for the checkups, or even if they have been diagnosed to have diabetes and high blood pressure, they don't come for regular follow-up. They don't do the regular tests as well for the kidney disease and the other organs like the heart. So it becomes quite a challenge, and those are among the most common causes as well for developing kidney disease or progression of kidney disease now.
All right. So what about people who use hard drugs?
You mean the recreational drugs?
Yes, recreational drugs.
So the recreational drugs directly may not cause kidney disease, unless, of course, if one of the excipients causes some reaction with the kidney. We call it interstitial nephritis. But they can cause kidney disease indirectly, because remember, those hard drugs basically cause high blood pressure. Like things like cocaine can cause very extremely high pressures, and it can cause damage to the kidneys. The intravenous drug users, those who use injectable drugs, they can introduce infections into the body. They can damage the heart as well by causing endocarditis, and when you damage the heart, you also damage the kidneys as well. The infections themselves can also cause damage to the kidneys as well. So those are the indirect effects in which the hard drugs can cause kidney damage.
Can alcohol lead to kidney disease? This is something that many people use commonly, and the people are asking the question.
So alcohol directly doesn't cause kidney disease, but it increases the progression of worsening kidney disease. Okay. Alcohol causes cardiac disease. Alcohol increases your blood pressure as well. Actually, there was a study that was published recently that showed that 4 hours after consuming alcohol, your heart rhythm basically can become abnormal for up to 4 hours, increasing your risk of sudden cardiac death.
So if you repeatedly do that, eventually you're going to cause
yes,
some trouble.
and it will cause problems for your heart, and then because of your heart and you're being affected and your blood pressure increasing, it can cause problems with your kidneys. Alcohol also causes liver disease as well.
Yeah.
Now, when you have liver disease, you can also develop kidney disease. There's a condition called hepatorenal syndrome.
Yeah.
Hepato is liver and renal is kidney.
Yeah.
So liver damage can lead to kidney damage as well. So indirectly, yes, it can cause kidney damage.
All right. What about cigarette smoking?
Excellent. So smoking has been shown to again increase the progression of kidney disease. So for example, if you have chronic kidney disease stage 2, stage 3, and you continue smoking, it can predispose you to developing stage 4, stage 5. It hastens the progression of chronic kidney disease
So you already
to the
have
end stage.
You already have the kidney disease.
Yes.
And if you're a smoker, you're going to make it worse.
Yes, it can make it worse.
Wow.
That's what happens. Cigarette smoking also causes cardiac disease or heart disease.
Yeah.
It can worsen your blood pressure as well. And both of those can now cause kidney disease
Kidney
as
disease.
well. Yes.
All right.
And of course, apart from the cancer aspect as well,
Yeah.
which is quite dangerous as well for smoking. Yes.
So what we are saying, you're saying basically is that though it might not directly lead to kidney disease, in one way,
Yes.
and eventually
Yes.
it's going to lead to.
Yes.
And that is the thing, because if somebody is a user of these drugs, right now you feel okay. But maybe, I don't know what time, let's say 10 years later, 15 years later.
Exactly. So once when you start using these drugs like cigarettes and alcohol, 10, 15 years down the line is now when you start seeing the effects, especially for your lungs, for your heart, for your kidneys. Alcohol also causes brain damage as well. So we have to be very careful and pass a message across to everybody that smoking is injurious to health, it's very harmful. Alcohol is also harmful to health as well.
All right. Thank you very much. So we're going to take a break, and we'll be back to continue the conversations about now the different types of kidney disease. So stay tuned.
You are watching TV 47, the home of untold stories.
There is only one planet in the universe that we know of that can support life. It's called Earth.
Just imagine at our generation wiping out a whole subspecies. Don't you think it's sad?
This world cannot really survive when we live alone. Cannot also survive if lions and rhinos just live alone. We need all the organisms together.
Join us as we get to learn about the animals that live on this beautiful planet every Sunday, 7:30 p.m.
Yeah, like you see, these are the fabrics we use for the sofas. Yeah, there are different types of fabrics. Sabak.
This is the best way to go. Eat color, eat raw, like this is alive.
Well, 2022 is behind us. 2023 is here with us. What are your plans? We here at TV47's Morning Cafe have great plans for you. We're talking about information, we're talking about entertainment, we're talking about the greatness for the year. So make sure that you're always with us every morning.
All right, welcome back. We are continuing the conversation on kidney disease. Next, we're going to talk about the different types of kidney diseases and how each of them is identified and treated. So, Dr. Hussein.
Yes.
So, you hinted earlier on about the different types of kidney diseases. Could you just go on and explain to us what these types are?
So broadly speaking, we can have kidney disease that is acute. We call it acute kidney injury.
Yeah.
And then the second type is your chronic kidney disease. So when you talk about acute kidney disease or acute kidney injury, it means kidney injury or kidney problems happening in somebody who previously had healthy kidneys. Mm-hmm. Okay? Like for example, if somebody comes into the hospital and had normal kidney functions before and has developed an infection like let's say malaria or dengue or a severe bacterial infection, and because of that then the kidney function starts getting deranged, and we notice that either they're not passing urine or they're accumulating fluid in the body is becoming swollen, and when we do the kidney function test, which is a blood test we do, and we find that the kidney function is not normal.
Yeah.
So that's how we basically identify somebody who has got acute kidney disease or acute kidney injury.
Mm-hmm. So, sorry. So, will you just mention a little bit about more the common causes of the acute kidney problems? So,
commonly, as I mentioned, is basically infections, very severe infections like malaria, dengue, bacterial infections. Like even if you get a very severe pneumonia, you can end up developing kidney injury because of that. Diarrhea and vomiting as well, which is now becoming very prevalent because of the outbreaks that we are having. So, I mean, we've had several patients who have been admitted to the hospital with cholera, and a few of them have actually developed acute kidney injury to the point of actually requiring dialysis to support them whilst we try to sort out the infection and rehydrate them, and subsequently the kidney function picks up. So we have had quite a number of patients, especially now in this past few days, who have come in with severe cholera and they've developed acute kidney injury. Yeah.
All right. That's quite something. So the second category you mentioned of the kidney disease.
Yes, so the second category is chronic kidney disease. It means that somebody who already has pre-existing kidney disease. Of course, it starts off as acute kidney disease. Majority of the patients, if they don't have the predisposing factors to develop chronic kidney disease, like diabetes, like hypertension, like family history, the kidneys can fully recover. But there are some whose kidney function does not recover, especially those who are predisposed to kidney disease like diabetes and high blood pressure and those with family history. Now for them then it basically they go on to develop chronic kidney disease. And chronic kidney disease, there are stages of chronic kidney disease, stage 1 to stage 5, depending on what stage the patient is on. It can progress more rapidly, like for example if somebody continues smoking, if somebody continues drinking alcohol, if somebody's blood pressure is not well controlled, if somebody's blood sugar is not well controlled, then it progresses faster. Or if somebody has chronic kidney disease and then they develop an infection, or they take these medications over the counter, like your non-steroidal anti-inflammatory drugs like Brufen, diclofenac, this can hasten the progression to end stage. Yes.
So basically, if you keep causing injury,
if
you keep causing injury to the kidneys. All right. So you have hinted already some of this, but let's talk about broadly, like how does somebody with a failed kidney look like? What are they going to feel?
So now this is a very important question, because a lot of people actually come in when they have stage 5 kidney disease or end stage kidney disease. And that is a time now when the kidneys have completely shut down. So by the time you're developing stage 2, stage 3, and even sometimes stage 4 kidney disease, unless if you do a blood test, you will not know that you have kidney problems. Okay? Because you'll just feel a bit tired, which is generally what most of us feel at the end of the day. Yeah? You might find that your legs are getting a bit swollen, but then you're like, oh, I've been standing the whole day or sitting for prolonged periods of time, and this is what is happening. So the symptoms are very non-specific in the early stages of chronic kidney disease, but as you now progress to end stage is now when the symptoms become more prominent. And that is unfortunately the time that we actually pick up for the patients that they have this stage 4 or stage 5 chronic kidney disease. And it's a bit late now to try and reverse it. And I always keep on telling people that if you have the risk factors for developing chronic kidney disease, then you need to have your kidneys checked regularly. That's the only time that you will know whether you have chronic kidney disease. That's the only time you'll know whether it is progressing or not. Okay? So for example, if you have diabetes, if you have high blood pressure, if you have a prostate problem in males, especially past the age of 50, that's very important as well, because an enlarged prostate basically causes obstruction of the passage of urine, and there's backflow to the kidneys, causing more damage to the kidneys. Okay? If you have a family history of chronic kidney disease, like if you have siblings or parents who have kidney disease that started at an early age, it puts you at risk as well, and you need to come to the hospital to have regular checkups done.
All right. So that's great. So initially you might not know.
Yes.
It's non-specific, but at least there are pointers out. If I am passing urine less frequently than usual, should I be worried?
Yes. It's always good to be on the safe side. Of course, I mean, you have to make sure that you are hydrating yourself well, because the most common cause of somebody who has been healthy and has noticed a reduction in your urine, especially in this hot weather, would be the fact that he or she is not hydrating himself well. So you need to hydrate yourself adequately and see if you are still not passing good amounts of urine or it has reduced in the past few days. I would recommend that you come for a health checkup to the doctor and see what is happening.
All right.
As I said, the only way to know whether your kidneys are functioning or not is by doing a blood test.
Blood test.
That's the only way.
All right.
Yes.
All right. So if you suspect, somebody should go and get checked.
Yes.
All right. That's great. Let's talk briefly about kidney disease and special groups. Kidney disease and pregnant women, and then children. Let's start with the pregnant women.
So normally pregnancy shouldn't be a problem for kidney disease unless of course if you get the other predisposing factors, like if you get an infection, if you get a stomach flu, you have diarrhea and vomiting and you get dehydrated, or in some pregnant women they get very high elevated blood pressures, we call preeclampsia, then it can it can cause damage to the kidneys. Okay. And the only way to detect that is, of course, if the pregnant lady is on follow-up with her gynecologist. So the gynecologist is the one who will pick up that yes, the pressures are extremely high. They'll have to do a urine test. They might do the kidney function test as well, and they will get to know that there is a problem, and then they call in the kidney specialist. And of course, if somebody has pre-existing kidney disease, then it becomes a challenge, because then there's always a higher risk of kidney disease progressing during the pregnancy as well. Because when the uterus grows in size, it will compress on the ureters. The ureters are the pipes that bring the urine from the kidney to the bladder. So if it compresses on that, then it is going to cause back pressure and may cause damage to the kidneys. So that's pregnancy and pregnant women.
So a question is, so if somebody has a kidney disease already, can she get pregnant still?
Yes, she can get pregnant. But if there's pre-existing kidney disease, then they need to work very closely with the gynecologist and the kidney specialist, so that we can advise them whether it is safe for them to proceed with the pregnancy, with the conception and pregnancy, or it is not safe. And if we do say that it is safe, then they have to be doing regular visits to the nephrologist and the gynecologist, and regular checkups as well in terms of blood tests.
All right.
That's very important.
Great.
Yeah.
So we're going to take a break. When we come back, we're going to continue with kidney disease with children, and we're going to look at treatment and much more. So stay tuned.
You are watching TV 47, the home of untold stories. Tonight,
musikuwe na wasiwasi. Tunaelewana? Musikuwe na wasiwasi. Itafanyika kwingine lakini haitafanyika Kenya.
there is no room for same-sex marriage or relationship in this country, says President William Ruto.
Sisi tunasema tunapendekeza bunge itengeneze sheria kulingana na hii mfungo ya katiba yetu ya 45 ili kusiwe na wasiwasi yote.
As political leaders across the political divide criticize the court's decision.
Speaker of the National Assembly was informed via my letter of 13 February. The Clerk National Assembly acknowledged receipt and confirmed the notification will be laid before the House on the 14th of February through a letter from the clerk dated 17th February.
Also tonight, Duale and Kindiki defend government's move to deploy KDF in the North Rift to combat bandits.
I have looked at other countries where insecurity has damaged the country's ability to survive as a nation.
They say the government is considering full-scale deployment of KDF to combat bandits. Plus, IEBC selection panel sworn in as Azimio leader Raila Odinga cries foul.
Wameweka jopo ambao ni yao, rafiki yao, kwenda kufanya hiyo. Hiyo ni kuanza kufanya rigging ya uchaguzi 2027.
Raila insists the government is plotting to rig the 2027 elections.
Na ndio tumesema kuanzia mwezi wa 6 nitafanya mambo kadhaa. Number 1, nimesema tunaondoa ushuru kwa mambo ya gas. Ile 8%.
And Kenyans set to access cheap and affordable gas by June this year. President William Ruto says the government will subsidize the cost of the 6 kg gas cylinder by more than 2,000 Kenyan shillings.
Here, like you see, these are the fabrics we use for the sofas. Yeah, there are different types of fabrics. Sabak.
This is the best way to go. Eat color, eat raw, you know, like this is alive.
Well, 2022 is behind us. 2023 is here with us. What are your plans? We here at TV47's Morning Cafe have great plans for you. We're talking about information, we're talking about entertainment, we're talking about the greatness for the year. So make sure that you're always with us every morning.
Kwa muonekano wao hauwezi ukajua waliopitia. Kwa sura zao zinapong'aa hauwezi ukafahamu changamoto zao. Nyuma yao ipo stori la historia. Katika kipindi Mfahamu Kiongozi tunakupa nafasi kuweza kuwafahamu kila siku ya Alhamisi kuanzia saa 1:30 kuendelea. Nami Elizabeth Mutuku.
Your health matters, and Body Garage is here to guide you on it.
Someone's, after using the medication, the virus number of the HIV in someone's body will start to go
my medication. Wherever I go, I must make sure I'm committed to my medication. Yes. And I should watch what I'm eating. I should not just eat from everywhere or not just eat anything.
We talk mental, physical, and spiritual health. Join us every Thursday at 8 p.m. Lover of farming? Well, Kilimo Diaries is your home for different farming ventures, crops, animals, and so much more. Every Sunday, with a new year comes endless possibilities, and as we continue to tell the stories of those abled differently, do make sure to join us on Beyond the Limit every Saturday at 7:30 p.m.
It's a new year, and with an
Experience resort-style living with a wide range of amenities, including a state-of-the-art fitness center, swimming pool, children's playground, 24-hour security, and concierge services. Experience the ultimate in luxury living and golfing at Nyali Golfview. Contact us today to schedule a visit and discover the lifestyle of your dreams. Nyali Golfview Residence, luxurious accommodations inspired by the Indian Ocean.
You are watching TV 47, the home of untold stories.
All right, welcome back. We are continuing the conversation on the kidney diseases. So we are back, and Dr. Hussein will continue to talk to us about kidney disease and children.
So kidney disease does affect children as well. The most common cause of kidney disease early on in childhood is basically congenital causes, like somebody will have either an abnormal urinary tract where the urine flows, they can have obstruction because of valves, the kidneys might not have formed properly. So that's the most common cause very early in childhood. And it becomes quite challenging to make a diagnosis, and we just have to be thankful for the moms, because they're the ones who basically pick it up that the urine is not very good, or the child is crying when passing urine, or the child's feet are getting swollen, the child is not developing well, is not feeding well. So that's the time when they take the children to the pediatrician, and the pediatrician then subsequently does the tests. Also, you can get these infections in children, the same things like diarrhea and vomiting, which can lead to dehydration. Infections like malaria, they can also lead to kidney disease as well in children.
All right, great. So let's move on to the treatment. So we found out that there is kidney disease, whether acute or chronic. What are the options for treatment right from the start?
So right from the start, it depends on the cause of the kidney disease. Like for example, if it's acute kidney injury, then of course we treat the primary cause, whether it's infections, it's dehydration. So whether it's basically your over-the-counter medications, like your non-steroidals, there are some antibiotics as well that can cause kidney problems as well. So we look at what has caused the kidney problem, remove all the offending agents, rehydrate the patient.
Yeah.
Unfortunately, there are some patients who do require dialysis temporarily, so we do start them on dialysis while waiting for the kidneys to recover. So we start them on dialysis. Dialysis is whereby there are two types of dialysis. There's a hemodialysis, which is what we do mostly in this country.
Which is blood.
Yeah. Hemo stands for blood. And then there's peritoneal dialysis, which is whereby we put a certain type of fluid in the abdomen, and then it is removed after 4 hours, which is where now the blood is cleaned.
Yeah.
So we mostly do hemodialysis, and which is whereby the blood is taken from the body, passed through a machine, it is cleaned, and then returned back to the body.
Yeah.
So once when the kidneys recover, then of course we stop the dialysis and we follow up the patients.
Yeah.
Now remember that once when you have had acute kidney injury, your chances of developing chronic kidney disease becomes higher, or even more acute kidney injury becomes higher. So anything small can trigger off acute kidney injury as well. So you need to be doing regular checkups with your nephrologist as well. So at least every 3 to 6 months, even after your kidneys have fully recovered, you need to come to the nephrologist to at least have a checkup done.
All right.
When it comes to chronic kidney disease, then again, what was the precipitating factor that led to chronic kidney disease? Was it diabetes? Was it high blood pressure? Was it your prostate that was enlarged?
Yeah.
Was it something like glomerulonephritis, which is an inflammation within the kidney?
Yeah.
So, of course, you have to control your blood pressure and your blood sugars, and I can't stress the importance of that. If you have diabetes and high blood pressure, it is absolutely vital to make sure that your blood pressure and your blood sugars are well controlled. Because they will continue to harm the kidney, the high blood pressures and the high blood sugars. If you have a prostate problem, you need to be on follow-up with your urologist. They give you medications. If your medications don't work, then you have to get the prostate removed. If it is inflammation because of glomerulonephritis, depending on the type, the certain medications that we use, and you have to take those medications regularly and be on regular follow-up as well. Now, unfortunately, despite all these interventions, some patients still progress to end-stage kidney disease.
Yeah.
Now, when you reach end-stage kidney disease, we have two options. One is dialysis, and one is a kidney transplant.
All right. There's nothing you can do when you say end stage. Nothing much.
There's nothing much that we can do. I mean, because of the toxins building up in the body, because of the water built up in the body, the acid built up in the body, your level of blood going down, these patients do require the renal replacement therapy.
Yeah.
And the renal replacement therapy, as I said, there are two types. One is your kidney transplant, and the other one is dialysis.
Yes.
Now, dialysis is supposed to be a stopgap measure. Every month, the government reimburses 76,000 shillings for one patient.
Per patient.
And currently, as per our database, we have 6,500 patients on dialysis.
In your hospital only?
No, in Kenya.
Oh, in Kenya, all right.
Yeah, in Kenya. And of course, almost 20,000 patients require dialysis. So some of them are not able to get it because all the dialysis units are full. And it's quite costly setting up a dialysis unit.
Yeah.
So as I said, the dialysis is supposed to be a stopgap measure, because once when somebody starts dialysis, then the next question is, when are they getting transplanted, so that they can free up the bed and somebody else can...
So dialysis is not an end in itself. It's a temporary thing as you look for the ultimate
kidney
solution.
Transplant, yes, which is ultimate solution.
Yeah.
And kidney transplant has got very many advantages. If you compare somebody who has had a kidney transplant versus somebody who's on dialysis, somebody with a kidney transplant will live much longer than somebody who's been on dialysis.
All right.
Okay, so that's just a direct thing that we can see. If you look at the economic benefits, once when you transplant somebody, they have to be on medications for the rest of their life. We call them anti-rejection medication, so that the body does not reject the kidney. The anti-rejection medications cost between 30 to 40,000 a month, which unfortunately the NHIF is not paying for right now.
All right.
But the NHIF is paying for the 76,000
For the
dialysis. So it would be much more economical for them to pay for the transplant medications than for the dialysis.
Yeah.
Because this is now the direct cost saving. So you're actually going to be saving almost 36,000 per month every month.
Per patient.
Per patient.
Yeah.
By 3 years, you've covered the cost of the transplant as well. So this is a direct cost saving that you're talking about. Then there's the indirect cost saving. Somebody who has been transplanted goes back to work, does not miss 2 days per week of their work. They're contributing to the GDP, the economy of the country as well.
More time with their family.
Then there's also the social aspect as well. They don't have to come to the hospital. They don't feel like they're a burden now to the family who has to bring them to the hospital as well. You see? So there's an emotional component, there's a social component, and then there's an economic aspect as well for the kidney transplant. Which is why I'm a big proponent that everybody who can be transplanted should be offered transplantation.
All right.
Yes.
All right. Because of time, just a quick one. What is the success rate of kidney transplant so far?
As I mentioned, here in MP Shah Hospital, we've been doing kidney transplants from 2018. Our success rate is 100%.
100%?
Yes.
Okay.
In MP Shah Hospital, we have very many centers do kidney transplants. We've been doing kidney transplants from 1980s here in Kenya. Yes. So we have the necessary skills. We have the capacity to do the kidney transplants. Yes. So I would urge and request the government to fully fund the kidney transplants and also the post-transplant medications.
All right.
And the reason being, when you ask a patient to get a kidney transplant and you tell them about the cost of the 40,000, then subsequently comes to 30,000 a month, every month for the rest of their lives for the rejection medications, the patient will tell you, but Dr. the government is paying for my dialysis fully. Why should I leave that and come and get transplanted, even though I know it is better, but I still have to fork out the money? So then we are stuck, because of course we can't transplant somebody then who will not be able to afford the medication. It will lead to a rejection of the kidney and more problems. So the economic benefits are all there for kidney transplantation versus hemodialysis. And I would just urge the NHIF and the government to please look into that.
Yeah, definitely. As we come to a close, let's talk about the World Kidney Day.
So the World Kidney Day normally is held every year from 2006. It is held on the second Thursday of March, which is going to be, this year it will be next week on Thursday, 9th of March. And as Kenya and as a Kenya Renal Association, we are going to be participating in the World Kidney Day. The theme of this year's World Kidney Day is preparing for the unexpected and supporting the vulnerable population. Yes.
All right. So what is it going to be? How is that going? That day going to be? What activities? What should we expect?
So normally the main aim of the World Kidney Day is to create awareness about kidney disease. So normally as the Kenya Renal Association, I'm the Secretary General of the Kenya Renal Association. So we hold activities for that whole week. So we recommend hospitals to be doing screening programs, free screening programs for the whole week from Monday to Friday. So every hospital does that, those who are interested in all the counties in Kenya. Then on Thursday, which is the World Kidney Day, for those of us living in Nairobi, we all congregate we'll be congregating at Kenyatta National Hospital, which is our main referral hospital. And there'll be certain activities, including a walk for that day that we'll be having. There'll be many talks that we'll be having at the Kenyatta National Hospital. There'll also be screening programs to check for diabetes, which is a very common cause of kidney disease, for hypertension or your blood pressure checks. Your urine tests will be done for free. There'll be doctors available on site to, of course, give advice about kidney disease and give talks. Yes.
All right. Sounds like it will be an educative day.
Yes. We hope to create more awareness. And also, we want to pass on a message to the government as well. We had this COVID-19 pandemic. Unfortunately, nobody in the world was prepared for it. We saw how it stressed our healthcare systems. Some healthcare systems actually buckled under and collapsed. And the most vulnerable populations and patients on dialysis are considered to be one of the vulnerable populations, suffered quite a bit. And even the patients who are transplant patients, kidney transplant patients suffered quite a bit as well. And this is why this year's theme is preparing for the unexpected and supporting the vulnerable. So like what happened in Turkey and Syria with the massive earthquakes. So all those patients who are on dialysis, getting dialyzed there, have now gotten nowhere to go. So we need to be prepared for that in case for any such eventuality, so that our most vulnerable population are always protected.
Great.
That's very important.
That's true. Yeah. Thank you very much. Because of time, we need to stop there. Because of time, there's a lot actually to talk about.
Yes.
So as you've heard, you're invited to the World Kidney Day, which is going to be on which?
On 9th of March on Thursday.
9th of March on Thursday at Kenyatta National Hospital.
Yes.
Thank you so much, Dr. Hussein.
Thank you very much for having me.